Good afternoon to all of you in Slovenia. My name is Al. I'm coming to you live from Chicago, Illinois. I'm privileged and honored to be here. I'd like to thank you, my friend Effie and Spira, and conference organizers, and also interpreters for making our talks accessible um, to people who don't speak English and speak other languages. I am here for two reasons. I am both a dad, and I am a professional psychologist. And what I'm going to be doing today is sharing with you lessons learned. Uh, I have been involved in rare disease for more than 25 years now, and I've picked up a few lessons along the way. My son, Jack, photographed on the left, was born with spinal muscular atrophy in 1995. Jack was a 6-month-old baby at the time, and at the time there were no treatments for SMA, and we were told that baby Jack would live to the age of 2 when he was 6 months old. Thankfully, my boy didn't fully cooperate with his prognosis. Jack was with us for 26 years, and in those 26 years, I learned a lot from him as his dad. And professionally, I'm a counseling psychologist, and my work now focuses on families like yours and mine who are affected by rare diseases all over this country and all over the world. On the right is a symbol of my work. This is our spinal muscular atrophy conference. A few years ago, we actually had this conference last weekend where our kids and adults have the opportunity to spend time with each other and talk with each other about the experience of having a rare disease. So I'm going to take you very quickly now on my own journey and on the journey that I take with my patients, rare disease advocacy organizations like yours, industry partners all over the world. And that journey often, as mine has, evolves from a place of fear when we're new at rare disease to a place of hope and then to a place of love. I'm going to take you from fear to hope to love in about 20 minutes now in terms of the emotional experience of being affected by a rare disease. And I want to start by telling you, those of you who are family members, how much I respect all of you for the challenges you face and the courage you show. And I also want to thank all of you who are professionals who choose to get involved to help us, because we can't do this by ourselves. The first lesson of the day is about trauma. On November 7th, 1995, I sat in a hospital room at the Children's Hospital of Philadelphia, and we were told that our 6-month baby, who was healthy for 6 months, wasn't so healthy. We were told that Jack had an incurable disease and that he would live for another year. For all of us who face rare disease, that moment when our lives change is burned into our souls. There's our lives before rare disease, and there's our life after rare disease, and it's burned into our souls when we remember that day when everything changed. The most common question I get as a psychologist is, Dr. Al, is it normal? Is this normal? Is it normal that I don't sleep at night? Is it normal that I'm scared all the time? Is it normal that I'm crying or that I can't eat? And when it comes to a newly diagnosed family member, someone like me and you who has a child all of a sudden who's diagnosed with a rare disease, the answer to those questions is almost always yes. It's a normal reaction to a very unusual and acute set of conditions. I myself, when Jack was diagnosed, and we don't have many photographs of this time because it wasn't a happy time. I was afraid to light the fireplace in our house. I thought I'd burn the house down. If something this bad could happen to our baby, then what else could happen? I was driving very slow in the right lane of the highway, thinking I'd get into a car accident. Our minds play tricks on us, and trauma is unfortunately very common when we have a new diagnosis. That's lesson number one. My second lesson that I picked up over my 25 years is about uncertainty. It's very hard for all of us affected by rare disease to live with uncertainty. As I interact with patients all over the world, this is the common thread the trauma and then the uncertainty, finding our way after we've been launched into the twilight zone of rare disease. How do we make our way? It's a very disorienting experience, a very disconcerting experience. And we're thrust into a world of uncertainty about our future and our family's future that we didn't anticipate. There's the existential level of uncertainty. How long will I live? How long will my child live? These are questions my patients ask themselves and ask me in therapy sessions. What will my life be like? Where is my place in the world? How do I fit in? The existential level of uncertainty in rare disease is complicated and very common. Then there's the day-to-day uncertainty. For me, as a dad, I rode around in a car with a suitcase of clothes and a toothbrush in the trunk of my car for 20 years because I never knew when we would end up in the intensive care unit with Jack because he would get sick very quickly. The uncertainty about caregiving. Will the nurse show up who's supposed to take the night shift tonight? Is the ventilator charged up? Do I have the elevator key for when my son goes to school? Is the wheelchair working? There are the day-to-day uncertainties that come with rare disease and the many complications that we face. This is a photograph from Jack's first birthday. And looking back, it was a happy occasion, but a very bittersweet occasion. Living with uncertainty was very hard for us as we thought our birthday party would be the only birthday party we'd have for our son. We were lucky and we had many, many more birthday parties. But the uncertainty in the house and in the room when we had this birthday party was very palpable. And we needed to make this day a happy one for Jack. And we had to teach others, our family members and friends, how to manage the uncertainty along with us. Lesson number 2, it's very hard to live with uncertainty. Third lesson I'd like to share today is about hope. When we're given very little hope at the time of diagnosis, where do we find hope? Where do people with rare disease find hope? It's a very scarce commodity. For me and so many others in our community, hope comes from role models who've been there, who model for us the way to move forward in such a complicated and scary situation. This is one of our role models. This isn't the best picture of Jack, but when he was diagnosed and I received newsletters in the mail from our Cure SMA family, I call it our family, I read a letter that this woman, June Price, wrote in a newsletter. She said, dear parents, I know that the news of SMA is devastating to you, and it was to my parents too. My dad was waiting for me to die my whole life. When I was 2, they told my parents I lived till 4. When I was 4, they told my parents I lived to 8. When I was 8, they told them I lived to 10. And now I'm 52 years old and I have a partner and I have a job and I live independently and I have a good life. And my dad's been gone for 20 years. So please, parents, live each day as though your child will live. This lit a spark in me, and June Price became a trusted friend of our family, and we went and visited her in Milwaukee, Wisconsin. Jack wasn't too excited by the end of that day. The only picture we took, he was pretty exhausted, wanted to get home. But we really learned a lot from June, who gave us so much hope. Role models do a lot for us. And June, these days, Dr. Al, I'm the guy that gets calls from people all over the place looking for guidance and support. And Dr. Al called June Price. She was my mentor. She lived into her 60s, and I'll always be grateful for her friendship and her support and her direction at times when I needed it. Lesson number 3, hope breeds hope. The fourth lesson I've picked up is that there's strength in numbers. Community strengthens and supports. And we have many, many different types of communities. We have school communities and work communities and faith communities, neighborhood communities. People want to help us when we're affected by rare disease. And when we're part of a group, we feel stronger, we feel supported, we feel less isolated. Remember what I said about being launched into the twilight zone. It's very lonely and isolating when you have a rare disease. So when we're part of a community and we learn how to accept support from the community, it goes a long way. Our rare disease communities, as you're sitting in one right now, give us special strength and special support. This is an image from our Cure SMA conference. We just had it last week, and we start our conference in the spirit of community with our doctors and researchers and families doing a wheelchair race where the kids race against the famous doctors and scientists, and the children always win. This icebreaker brings everybody together in the spirit of goodwill and the spirit of togetherness. It strengthens and supports us. Another symbol of our community strengthening and supporting. I'm so privileged for about 20 years to facilitate our what we call Talk It Out groups for our children and young adults with SMA. These groups gave the children an opportunity to share together without their parents in the room the experience of having a rare disease. The kids always ask, Dr. Al, how can we get our parents to stop worrying about us so much? And the girls talk about the middle school dance and how to go to the dance with a wheelchair. They give each other advice about what to do when adults assume they have a cognitive problem when they only have a physical problem. And these are awkward social situations for these kids. I co-facilitate this group with my friend Angela, who's in the back right corner, a very, very gifted public school teacher in Texas who teaches fourth graders in a public school with a wheelchair and SMA. She's a very gifted teacher. She and I have been doing this for a long time. And in the photograph where I'm standing on the left is my daughter, Kara. We adopted a baby girl from Korea when Kara was 4 months old. Jack was 5 years old. Kara's all grown up now, and she's a volunteer at the conference. And she now is employed. She's 24 years old and works at the National Organization of Rare Disorders in the Patient Registry Department. I'm very proud of my daughter for so many reasons. But lesson number 4, community strengthens and supports. We have to stick together to bring that power and that support to each other. We need all the help we can get. Lesson number 5, those of us who are thrust into this world of rare disease, we meet a lot of people in the healthcare system. And the healthcare system in our country is not easy to navigate. It isn't for people who don't have a rare disease, and it certainly isn't for people who do. There are some really wonderful, good people who are kind and caring and humble and choose to get involved in helping us. And the doctors and nurses and other healthcare professionals who take care of our family members are to be thanked for their devotion, their commitment, and the challenges that come from their work. This is a symbol of those good people. Dr. John Bransema is a friend of ours who took care of Jack, who's a neurologist at the Children's Hospital of Philadelphia. This is a Sunday afternoon, a charity event for our Cure SMA group, and Dr. Bransema took the time to come on his own time to hang out with Jack and the other kids. A very special person who was with us all the way till the time Jack passed and attended our memorial service for Jack as well. Doctors and nurses are people too, and we need to learn to be partners with them, to work together with them. They're working hard. We only have to know about one disease. They have to know about all of them. And it's our job to be teammates with them and to show our gratitude to these good people who help us. Lesson number 5. Lesson number 6, anything is possible. Again, we move from a place of fear to a place of hope and possibility. When we receive a rare disease diagnosis, it's very common for us to only hear about what will not happen, what can't happen, what our child won't do. Jack, they told us, wouldn't walk, wouldn't be able to swallow food safely, wouldn't be able to cough when he got a cold, wouldn't be able to go to school without taking a life-threatening risk. There were so many things when he was a baby that we were told were impossible. So we need to turn our attention psychologically to what is possible. What can I do? What can my child do? What is in my control? And I found over my 25 and plus years in rare disease that there is so much that is possible. A symbol of this along my son's life was his schoolwork. That computer that you see has a camera. There's a pad there with a camera aiming at my son's left eye. And with that camera, in that eye gaze unit, my son could type 20 words a minute. He had 2,500 Facebook friends. He had 2 part-time jobs. He was doing market research for a school where I had worked. Um, Here, he's doing his high school trigonometry homework with a Texas Instruments calculator on the desktop. And this was a time where, as parents, we find that our kids are doing schoolwork that we can't help them with because it's too hard for us. Anything is possible, and I never imagined in my wildest dreams when Jack was a baby that he would be doing trigonometry by himself and that dad wouldn't know how to help him. It was a beautiful moment. Lesson number 6 is anything's possible. The 7th lesson to share with you today, and we just heard some wonderful, I just sat in on a couple of wonderful research presentations. Scientific progress brings so much new hope and some unexpected challenges. Listening to the presentations today reminded me of our SMA conferences some years back. Before we had treatments, we now have 3 approved treatments. And because of the progress that has been made in our community, the children are now walking who used to use wheelchairs. We are so blessed to have scientists who are so smart and who can figure out how to treat our rare diseases, and there are more and more coming. That same wheelchair race this past year, a symbol of the scientific progress bringing new hope, is this little girl who walked in the wheelchair race. She didn't need a wheelchair because she's been given treatment for this condition. And the joy and the hope and the celebration that came through this moment for our community and many other moments is really, really beautiful and very, very amazing. Along with the progress comes some new challenges. When a new treatment comes, who's going to pay for it? Who's going to have access to it? When does it get approved? Where does it get approved? And when industry partners have managed access programs, for instance, who gets chosen to have this very expensive commodity when there are only a certain number of doses that are available? I've been involved in some very complicated ethical discussions and situations when decisions had to be made about how to allocate a very scarce commodity. So there's wonderful new hope, but lots of challenges that come when we have these new treatments. I like to say that I'm from the Flintstones era of rare disease, and the scientists and the researchers and industry partners are the Jetsons. These are, for those of you who don't know, cartoons back in America, the Flintstones to the Jetsons. These problems are all good problems, but we do have some new ethical challenges that come from the scientific progress. These are all good problems, though. Lesson number 7, scientific progress brings new hope and brings new challenges. And my final lesson for today, number 8, is this took me about 20 years to figure out and to feel and to articulate. But over the course of my son's lifetime, and I've gotten to know so many other families, children, families, and adults with rare disease, there are some unanticipated rare gifts that come from having a rare disease, moving again from a place of fear to a place of hope and to a place of love. The first gift is perspective. How many people do you know who can enter a room and without saying a word, everybody else's big problems get small really, really fast? This is Jack's high school graduation, and when he entered the sports arena with hundreds of people, a couple thousand people at a large high school graduation, everybody noticed Jack and everybody's big problems got smaller. This happened over and over and over again in his life. The gift of perspective. And as you can see, those kids were pretty tired, probably out at a party the night before. Jack, wide awake, happy. It's a big party every single day. He offered perspective, the gift of perspective. Another gift is resilience. I've met dozens, hundreds of children and families who offer so much resilience in the face of adversity. When Jack came home from the hospital, from the intensive care unit, one of the first hospitalizations, I was afraid that he would be too weak to get into his new power chair and drive it. I got him in the power chair and He couldn't move blocks with his hands, but he could knock blocks over with his chair. I was afraid he'd be too weak to get in the chair and to do this. I was the one who was tired. He'd knocked these over 200 times, and I picked him up 200 times, and I slept really well that night. I was exhausted. He was fine. Our children and adults with rare disease offer us the gift of resilience. Creativity. We can't do things the way everybody else does. For 26 years, there was nothing that my son did the same way everybody else did. So we all have to think out of the box in rare disease. We have to adapt. We have to be creative. We have to find different ways to do things. And our industry partners do too. And our FDA here in the United States needs to think out of the box about approving drugs for our families. We can't do things the way everyone else does. And my son couldn't either. This was a photograph taken at a special camp he went to called the Pennsylvania Event Camp. You see, he had a ventilator at the time, from the time he was 20, at a tracheotomy, and they put Jack and his friends on a zip line with the ventilator. This shows the gift of creativity. Only people who could think out of the box could do this safely, and to give these children and adults the opportunity to be out in the woods and have an experience so creatively with a dance and with arts and crafts and with nature and with a zip line and a food fight and everything else that kids do when they go to camp. Rare disease does come with the great gift of creativity. Gift of compassion. My son and so many of our kids are magnets for open-hearted, compassionate people. My son drew compassionate people into his life every second of every day. A magnet for these wonderful people. An example is Nurse Stacy. Nurse Stacy is a night nurse, a home care nurse, who took care of Jack for almost 10 years, 3 nights a week, 12 hours a night. She never missed a shift. She was one of the most open-hearted, compassionate people I've ever known, and I've met so many who were drawn into my son's life. When it was Christmas and I asked her, Stacy, are you planning to work on Christmas? It's a Thursday, because she always worked Tuesday, Thursday, and Friday. Her response was, Jack can't take a vacation from SMA, so why should I take a day off on Christmas? I'll be here. And she was there. No matter what the holiday was, she was there. Our children, our families draw in open-hearted, compassionate people, a rare gift. Rare disease also brings us the gift of connection. I see all of you sitting out there at your tables in Slovenia together, connected. Communities connect. Our kids bring together people. There's a mutual respect you all have for each other. We collaborate and support each other. We lift each other up. We don't pull each other down. These connections that we have between families and between professionals and families go a very long way, and there's so much mutual respect. This is a photograph taken at that special camp where Jack went down the zip line, the Pennsylvania Event Camp. These children and adults who volunteer have a very special connection. Rare disease brings people together with strong bonds and strong connections. When my son passed away, the people who were first to reach out to me and offer their support were these friends of Jack, these young adults who have rare diseases and use ventilators, who said, Mr. Freedman, we're here for you if you want to talk. We miss Jack. He was our brother. And they came to his memorial service and they stay in touch with me because of the strong connection. These young people and the nurses who are there taking care of these young people are a family, and they're strong bonds, and they'll always be family to me. And finally, from fear to hope to love. Again, I look back on 26 years with my son and the rare gift that he brought to so many lives, and to me was the gift of love. A rare gift that my son had was the ability to love other people unconditionally, and he received unconditional love in return. I see this love reflected from family to family and within our rare disease communities and with the providers who help take care of us, the researchers and doctors. And as I look back at the 26 years with my son and supporting so many others in the rare disease community as a psychologist, I marvel at how much I've learned from my son about love. And I marvel at how much that has enabled me to learn from so many others who face similar challenges around the world. So I'll finish with this message, which is that each of us and each of you possess many, many rare gifts. And it's my sincere hope today that along with the many real difficult challenges, the real challenges, the difficult challenges, the adversity that our families face and your families face because of CT NNB1, my hope is that you will be able to discover and you'll be able to celebrate the unique gifts that you bring to the world, and that those same gifts will be reflected back to you as you make your way through this complicated experience of rare disease. I've said for many, many years, 20, 25 years, we're all in this together, whatever this is. And I so appreciate you including me today. I hope that the conference and the rest of your day together is productive, and it's truly a privilege to be here. I thank you for having me, and I am happy to receive questions as well. Thank you so much for taking the time.